The first doses of the COVID-19 vaccine marked for Canada will arrive on Monday, with nearly 250,000 doses expected by the end of the year. In the meantime, officials are in the process of reviewing applications from other vaccine manufacturers such as Moderna, Janssen, and AstraZeneca. Joining us this morning is infectious diseases specialist Dr. Isaac Bogosh, a member of Ontario's Vaccine Distribution Task Force. Doctor, let's jump right in. The general population is expected to start getting vaccinated in April, but if any of these other vaccines receive Health Canada approval sometime soon, could that timeline be shortened?
It could be shortened. A lot of it depends on Health Canada approving these vaccines. We've actually seen that that's probably not going to be the rate-limiting step. They were pretty efficient in approving the Pfizer vaccine. But, of course, the other rate-limiting step is the global production of these vaccines and them having enough of this vaccine to ship it to Canada so that we can roll out these programs. I think the second vaccines land on our soil, we'll roll them out into programs once they've been approved by Health Canada. But, of course, there's an insatiable global demand for these. So we'll get what we get when we get it. But when we do get it, I think there's going to be a very short time interval before needles start going into arms.
All right, well, each province has denoted which populations it has prioritized vaccination for. For example, in Ontario, they include long-term care residents and staff, other frontline healthcare workers, and Indigenous communities. Talk to me about the knock-on effects that'll come with vaccinating our most vulnerable.
Yeah, so we always often talk about herd immunity. You know, we need a large proportion of the population to be immunized, around 60, 70%, for there to be herd immunity. But of course, you can have some tremendous benefits long before you get herd immunity. So if we vaccinate the most vulnerable populations, just for example, those in long-term care who reside or work in long-term care, I mean, first of all, you're going to save lives. We know that that's 80% of the deaths in Canada right there. And if we can really prevent those deaths from happening, we'll do a tremendous good service. The other thing, too, is it alleviates pressure from the healthcare system as well. So there's some ripple effects as well. So it's clearly the ethical thing to do, but it also will have tremendous benefits for the rest of us in Canada as well by preserving our healthcare system. And of course, we still have to be careful. We still have to mask up, physically distance. You know, we have to do all of this until we have tremendous numbers of people vaccinated in the general community. But even with the early vaccines, we can do a lot of good for individuals, but also for the country.
Doctor, let's talk timelines. How long could it take after we start vaccinating people before we actually see a significant level of protection against this virus?
You know what's really interesting is with the Pfizer vaccine, there was some data released the other day demonstrating that, you know, it's a two-dose deal. You're supposed to get a vaccine on day 1 and then day 21. And initially we thought, I mean, the medical and scientific community thought that you would have some protection about 7 days after the second dose. So that's about a month after you started the vaccine series. But now what's come out is that there's really good data demonstrating that you actually have some decent protection about 10 days after the first dose.
Wow.
Of course, you still have to get the second dose, and that will provide greater protection. But I think that we're going to start to see some very early benefits from this vaccine as they start to be rolled out, namely because of some of the protection people get after dose 1.
Doctor, this is all really exciting news, but of course we can't forget that people still need to wear masks, socially distance. We're not there yet. So we appreciate your time, we appreciate your insight and your expertise.
Thank you so much. Have a great day.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.